to Hendy to be here, and who is the lead of London Transport, works with the Mayor, and I'm very grateful for your time. And this is the health and well-being session, and we know what you've done in transport and the impact on health, and I know and I'm aware of the study that you did and that impact, which is tremendous. So I just wondered whether you can share with us some of your thoughts, and then I'm sure my colleagues are desperately keen to get some ideas and advice from you.
Sure. So thank you for your welcome, and it's good to be here. A brief introduction might be helpful, I hope. The Transport for London is a functional body of the Greater London Authority. It's chaired by the Mayor, who is effectively my boss with the board. It's one of the world's largest strategic transport authorities. We're now in year 14 of our existence, having been set up at the same time as the Mayor in 1999. I'd say as an aside, and in comparison with some elements of the health service, it's delightful to have such organisational stability, because you can spend more of your time actually doing the real business. Transport's not an end in itself. Transport is a means of creating economic wealth and social cohesion, and because of the large impact of transport in a world city, we've always been interested in the crossovers between transport and health, as you'd expect. Not only do we have responsibilities in line with our functions in a major city, but we're also a large employer, so we employ something like 27,000 people and attempt to follow good practice there as well. You've got my colleague Michelle Dix, the Managing Director of Planning, on your expert group, and I was going to mention that we are striving to publish shortly a detailed transport action plan within the life of your commission. Fantastic. So that you can see in detail what we're proposing to do. We think that our activities, in as much as you're interested in them, can be broken down into some broad headings. So, access to healthcare. We've always been very concerned about access to healthcare, particularly with the changing nature of the health service and the physical premises where it's carried out in. We have worked as hard as we were able with London NHS, and we strive to continue to work with all those people who are making decisions about where healthcare is provided, because in general there's been a progressive change from local, probably poorly equipped premises, but ones which have good access, into purpose-built places which in the worst cases frankly are in the middle of nowhere, and where the NHS has realised market value from some very unsuitable properties, but it's actually created permanent costs in terms of transport provision to new premises. So we would say we needed to be involved at a strategic and at an early level about that. Physical activity is a public health priority in London. Public transport, cycling and walking can help enormously in allowing people to live healthier lifestyles. We strive to produce the best transport networks we can, and to take everybody to work, education and hospitals and social activities on those. But of course there's also a huge emphasis on walking and cycling. The Mayor is a passionate cyclist. He's committed to spending a lot of money on cycling infrastructure, but that's the means. The end is to increase the number of people cycling in the city. The other part of that is improving the public realm, which is an encouragement to cycling and walking, and we're spending money on that too, and we spend money on that through the boroughs as well. The Mayor is concerned about air quality. Air quality is worse in London than the rest of the UK. Transport contributes significantly to this. We've got large programmes to seek to improve air quality, with a whole combination of means, which I'm very happy to talk about if you want me to. Road traffic collisions and injuries are now at their lowest level for 30 years, but fear of road danger is a deterrent to cycling, and vulnerable road users make up most of those killed and seriously injured, so that's of concern. And doing things about the street environment, making the public realm attractive and accessible, improving access to public transport all helps to reduce inequalities, because proportionately the poorest and most vulnerable people are more likely to live, work, shop and spend time on some of our heavily trafficked roads, and are less likely to participate in some of the things that might be good for them in terms of transport provision. So we'll wrap up all our detailed actions in this further health improvement action plan when we manage to publish it. In the meantime, a lot of what I've talked about is referenced in the London Plan and in the transport strategy, and of course, and you know, you're recognising this by having a whole variety of people giving evidence. This is a collective. This is a collective piece of work. You can't do this on your own. And equally, even if we just look at this from a transport point of view, there are some quite serious impacts on health, both positive and negative. So that's my
Thank you.
5-minute introduction.
Thank you.
Any use to you?
Thank you. Absolutely. I mean, I think the two, you mentioned all of them, but the two main ones, air quality, physical activity, are the two, and also the road traffic injuries. You know, what could this commission do to help with that? So, any thoughts, any questions or comments or?
Thank you, Chair, and thank you, Sir Peter, for joining us today. We're really looking forward to this action plan. As you know, we're working actively with you through the public health specialist route to try and find the common ground, really, between transport and health, and doing well on that, getting a lot of support from you. If you had recommendations, though, to make from your experience about what we should be asking you to do around reducing inequalities through the use of space, through the promotion of healthy transport and so on. I mean, what would you be saying to us if we gave you a blank page?
Well, I expect nearly everybody you're ever going to see is going to say, well, if we had more resource, you could do more. The speed of change in all these things is related to our capacity to do it, both our financial capacity, our technical capacity, and just the sheer size and scale of London. So, despite a lot of political criticism, I think it would be quite hard to represent that you couldn't do more. For example, about cycling currently, you can't open a newspaper without reading people saying, "Why don't you do what you're doing faster, quicker?" The answer is, in terms of physical measures on cycling, in terms of segregation, which certainly makes people feel safer, there's no doubt about that. We are working as hard as we can in some very difficult circumstances, notably that the city is many times the size of Copenhagen or Amsterdam. It doesn't have wide streets in many places, so segregation is quite difficult. But I mean, there's always a resource element to this. So, the faster you can change the public realm, the more attractive it is to walk in. We know that actually giving suburban town centres a different look and feel will really encourage people to get out of their cars and walk in circumstances where if you don't do that, there is no encouragement to do that. Air quality is again, it's a collective task. The Mayor has a responsibility for air quality in London, but much of the sort of statutory drive for it is either national or EU wide. Actually, there's a limit to what we can achieve in those areas without actually government taking action, and in some cases the EU taking action. Because actually, the design and manufacture of motor vehicles is now an international business. So actually, if you want to change the minimum standards applying to them, you have to wait for international moves. That isn't to say that there's nothing we can do. Actually, the low emission zone is a significant step forward. The Mayor is asking us to work up an ultra low emission zone for central London. We have driven the whole of the bus manufacturing industry in the direction of hybrid vehicles by buying them in quantity in a way you wouldn't otherwise do. You'll have seen a very brave announcement by the Mayor in the last few days about low emission taxis, which is not to the taste of everybody in the taxi industry, but undoubtedly, if you don't push, in things you can push on, then you don't get the response. So I think the consequence of the Mayor being firm about no new taxis from January 2018, except very low emission ones, or ones capable of zero emissions, will make a huge difference, because that encourages the manufacturers to do things seriously. It's those sorts of things, and similarly in road safety, we have a particular problem with heavy goods vehicles, construction vehicles, tippers and the like, and cyclists, and we can push as hard as we can. We can organise the things that we can do locally, and we're in discussion with London councils about a London-wide ban on vehicles without safety equipment. We can talk to the government nationally about whether they change the construction and use regulations so as to not allow exemptions, and we're also talking to the EU about changing the design standards for new vehicles. So, so I've talked about some other constraints apart from financial. It's always true to say that if you had more money, you could do more. The constraint in some of those areas then is the technical capacity to change, and I guess that's the same. I know nothing about the health business at all, but I'm sure it's the same there. We've probably got most of the really good people in traffic management and highway design in Britain. It's far more complicated than the rest of London. So however fast you want it to do some of these things, you've got to allow you've just got to have recognise the physical capacity for it.
Okay, great, thank you. Anyone else, Kath?
Yeah. I believe the evidence is quite good. Public health evidence is quite good for the 20 mile an hour speed restrictions in terms of reducing RTAs. And given both the terrible impact on many people's lives if they are involved in a serious road traffic accident and the cost to the health system, is there not a way in which health and transport can come together here? Because I'm struck by the fact that while 20 is written on many of the roads around London, there's very little done to actually enforce that except in a few areas, and what your views on that might be.
So there clearly is a significant correlation between speed and the severity of road accidents where they occur, and there can't be any controversy about that. We are a highway authority. We have 5% of the road length in London, but 30% of the traffic. So the roads that we directly control, which we call the Transport for London Road Network, are the major arterial routes principally. Relatively few sections of those are suitable for 20 mile an hour. There are some, and actually we're looking at some of those now to see what you might do. Most of the roads are borough roads. Some of the boroughs have been quite forthright in pursuing 20 miles an hour, and I don't think that the Mayor doesn't have a problem with that. There's no reason why he should do, actually. But most of the roads to which it might apply are in fact not ours, and it's one of fragmentation of responsibility must again be familiar to anybody in the health service. You've got 35 highway authorities in London, and we're only one of them.
So is that worth challenging?
Well, it's certainly worth pursuing, and there are people pursuing it on a local basis. There's an issue about enforcement. There's an issue about whether or not you can use the technology which is used to enforce higher speeds for 20 miles an hour. We've talked about running some experiments on a sort of area-wide basis. There are differing views on that from some organisations. Equally, it's quite clear that adherence to speed limits, even existing speed limits, is critically important in actually preventing loss of life and serious injury.
Thank you. Any other? Yes.
Can I just ask you what you think the responsibility is for Transport for London for encouraging less use of transport and more walking? That sounds like counterintuitive, but is there a responsibility?
Well, whether it's less or not, and the context of the way in which we're working is that London is expanding, so the overall demand for transport in London is rising anyway. There are many circumstances in which we would rather people walked, and we do believe that we have a responsibility to encourage people to walk. So the Legible London scheme, on which you'll see if you go outside, not very far away, helping people with signposting, maps indicating how long it takes, whole programme of work in tube stations to encourage people to walk the last few hundred yards of their journey are sensible. There's quite a lot of debate with practitioners about whether or not you should be trying to suppress travel or not. I'm not sure. I mean, some of that is actually about the wider design of the city. Some of that you have to address at the London plan and the relationship about where people live and what services are available within walking distance and how far work is, which is not, I mean, I'm coping with the consequences of that rather than actually deciding what that should be. There's no doubt, I think, that the ability to move in an urban area is something which should be encouraged. Whether or not the city is planned so that people can access more things locally and do it in a way that doesn't need them to use motor vehicles or indeed public transport, it's highly desirable. But then if you look forward actually to the predictions of where, for example, jobs are going to be created, the truth is that on any reasonable... I was just reading the revised draft of the London plan yesterday, and on any reasonable analysis it looks likely that the population increase will be concentrated in suburban London and the jobs will be concentrated in a few key economic areas in central London. So that doesn't bode well for asking people to walk to work, but you could ask them to walk the last few hundred yards at each end. There isn't, there's a compelling reason why you can't have large-scale car commuting, certainly on a radial basis in London, because the whole place would come to a standstill, and that we should be encouraging, and we're trying to, or cycling, or using cycles. Why not?
I was just wondering, coming to the standstill thing, presumably there's a relationship between congestion and emissions, and how much of the strategy that you have is to keep people who are wanting to move around the system flowing?
Well, of course, the congestion charge in central London was designed to reduce the number of vehicles on the roads, and it was pressed for by business because they could see that the congestion was actually creating economic damage, and if we're just running a consultation to increase the level of the charge for the primary reason of keeping it effective, of allowing it to remain the same in real monetary terms, so that it doesn't lose its value. We're trying to manage the road network to reduce congestion because, as you say, there are significant air quality disbenefits from having congestion. Whether or not you extended a charge in a wider area is a very difficult political subject, and one on which people stand for election. But we can do a lot to manage the road network, and we can we can make an attempt to ask people to change their habits as well, and make them aware of the alternatives, so that actually, if you like, the prospect is in a city which is going to be 9 million people by 2018 that the level of congestion would otherwise rise unless you do something about it. So we're doing what we can in technological terms, and we're setting out to do what we can in making public transport attractive, making the alternatives attractive, if only to leave the road space we have got the minimum that we need, so that you can create decent urban environments, and also for the traffic that needs to be on it, allowing it to move reasonably effectively.
Thank you, Chair. Just a quick one from me, Peter. And the little cartoons during the Olympics about, get off a stop earlier and walk, they're fantastic. I mean, at some stage, presumably, they'll be collector's items. But we're not really using them anymore, are they? And at the time, I think they did actually hit home to people. You looked at them and laughed, and then you thought, well, maybe we could do that. So where have they gone, and should we not be trying to collectively do this sort of thing just as normal?
So we're very proud of the travel demand management that we ran during the Olympics, because if it hadn't have been successful, then we would actually have either stopped London working, or stopped either the competitors or the spectators getting to the game. So it did work, and a third of people in London changed either how they went, when they went, or where they went during the period of the Olympics. We've taken away the ideas that we used for the Olympic period what really made a difference there was that we told a compelling story to start with to people's employers, actually, in the areas that would be affected, to say, well, you've actually got to do something, because if you don't, your businesses will suffer. That's not a bad place to start, and it also has the elegance of dealing with very large numbers of employees at once. And we did then, closer to the games, reach out to smaller and smaller employers, and then to the travellers themselves. I think our feeling on that is that you've got to have some compelling reason for this. People won't get up half an hour early just because we say it's good for them, and indeed you sound as though you're preaching if you're not careful. But we haven't given up. We're actually busy using the techniques we've learnt on a longer term example at London Bridge. London Bridge Station's being rebuilt over the next 4 years. It's already started. So from now until 2017, maybe a bit less than 4 years, there's going to be a significant reduction in capacity on the mainline side at London Bridge. So we've set off with our partners, because it is a partnership job. We've set up with our partners in London, in Network Rail, in the train operating companies, to try to reduce the travel demand at London Bridge over the period of the works. Now, this is quite an interesting area to go to, because I think that what we did during the Olympics was the largest programme ever done anywhere, with a reasonably successful result. If we do this at London Bridge for 3 years, it will certainly be the longest programme done anywhere. And where we're going is to try to say again that there's some benefit in this. So we're approaching employers who might otherwise find that their employees don't turn up at the time they expect them, or that it's more difficult in the longer term to recruit. And we're also obviously approaching travellers, because in the age of modern information technology, there's a whole load of stuff that you can get immediately, and we're finding that people do. And over the next 2 to 3 years, if we discover that will work at London Bridge, then we'll have developed some techniques about doing that in a sort of longer term way. You'll also have seen, perhaps there was some comment in the media about us encouraging people to change their habits on the south end of the Northern Line. The south end of the Northern Line is full every day, and despite re-signalling it, even if we get a couple or 3 more trains an hour down there, it will continue to be full. So we set out, again, in a sort of smaller scale way, but trying to find things which attract people to making some change, even by a quarter of an hour. It's quite subtle stuff. My predecessors have been out putting up posters saying, please travel between 10 and 4 and avoid the rush hours, for about 100 years. And they're lovely posters, but nobody ever took any notice of them. So actually, you've got to find a different way of doing this, which actually appeals to people in a way that they feel confident, and they feel changing their habits are worthwhile. And it's subtler stuff. But we're encouraged by the Olympics, because people did, there's a lot of sort of crass comment in the media about the mayor telling people to stay out of London, which is all nonsense, actually. It was designed to say, it's in your interest to do something different. Let's help you do something different. And I think the difference is between a 6-week international sporting festival and some techniques that you might like to use in the medium to long term in a very crowded city. And we're it's work in progress. So, and we'll try more of it. We're also trying to replicate the more deliveries out of hours, for example, so that we can reduce the pressure on the road network for primarily for congestion reasons, but also for emissions reasons, and that's work in progress as well. There's a lot you can get people to do for 6 weeks. It's harder to persuade people to do for the rest of their lives, and it's certainly not clear that a financial inducement is necessarily the answer. No. It might be part of the answer, but actually we feel that people have got to find that they've got some personal benefit, or their employer's got some benefit out of this, and then you can get some movement.
Thank you.
Well, it's been fantastic. I have to get this off my chest, because this came up probably the wrong thing, but is London Underground under you as well?
Yes.
Yeah. Exclude rush hour. If you slow the speed of the escalators by 50%, well, 70% of them will walk up. just a thought for you to think about on your way back. But,
yes, it's interesting. Some of my predecessors built stations which were so small that it's actually in our interest to get them in.
To get them out quickly. Yeah, that's what I thought.
The dynamics of that are. I can see exactly where you're going, but just go and look at some of the fixed staircases we've got.
Yeah.
We want them in. We want them in and out, even if they don't take exercise on the way. But that's our burden.
I can't thank you enough for taking the time and being here. And if there's anything we could do in this commission, then I'm sure.
Well, Michelle will be there to help the detailed working group. I mean, I'm convinced, which is why I was keen to come. I'm convinced that actually by working together, there is a lot that we can achieve. And if you sit where I do, then actually failing to recognise this connection between transport and healthy lives and public health, it would be a bigger mission.
Yeah. Fantastic.
Good.
Thank you again.
Thank you.
Cheers. Thank you. I think we're done with the session. I'm sure you can drop us a question. Do you? Okay. Walking is good for you. It doesn't have to be in platform. Could be on the street. Yeah. Okay. So thank you very much, Sir Peter. I'll let you off and.